Welcome, everyone, to the second in a series of NextGen at Work, hosted by NAMI and supported by the Hartford. We will be getting started promptly at 8 p.m. Thank you so much for being here with us tonight. Thanks, everyone, for joining us tonight. Just wanted to stop in and let everyone know that we will be starting promptly at 8 p.m. We appreciate your patience and for being here with us tonight. Thank you, everyone, for your patience. We will be getting started in just a moment. For those of you who are joining us live, please take a moment to drop in the chat where you're watching us from. We would love to see how far and wide we're reaching. All right. Thank you all so much for being here. My name is Jennifer Rothman, and I am the Director of Youth and Young Adult Initiatives here at NAMI, the National Alliance on Mental Illness. We are so pleased to have you all here with us tonight. We're excited to be offering the second webinar in a series called NextGen at Work. This is presented to you by NAMI and supported by the Hartford, our amazing partners. And we're excited to talk with you all tonight about making mental health benefits work for you. I did just see a question and answer mentioned that the chat is disabled. We will look into that on our end, but I do know that the Q&A is working. For those of you joining us, if you go down to the three dots in your Zoom or under where more is, you should see something for Q&A. So if you want to take a moment and let us know where you're watching from, we would love to see how far our reach is. So with that, I am going to hand it off to our amazing presenters tonight.
Hello, everyone. This is Meg Delp. I'm with NAMI, and we're so glad that you're here with us. We're presenting along with Anabel from the Hartford, and Alex, who will also be joining us. She's a NAMI NexGen alum. We'll get further into our bios in just a little bit, but tonight we are going to talk all about making mental health benefits work for you. We are going to go through who we are exactly so you know who you're listening to. Alex is going to share some of her experience about her own mental health benefits journey. We're going to go over what your typical options are at work, how to have the conversation around mental health benefits at work, and then finally some good questions that you can ask your company or a potential company if you are in the interviewing process or thinking about finding a new job. So a little bit more about myself. I'm again with NAMI. I am their Director of Workplace Mental Health. I'm also a licensed marriage and family therapist with a background in organizational psychology. I specialize in burnout, relationships, trauma, and I use all of that information along with my organizational psych background to do some great workplace mental health stuff with NAMI. I'll pass it over to Anabel.
Thanks, Meg. Good evening, everybody. My name's Anabel Cloutier-Perez. I'm a licensed clinical social worker, and I'm a clinical manager at the Hartford. I oversee the behavioral health department and the group benefits disability organization, and I'll get deeper into what all of that means a little later. I have over 20 years of clinical experience in mental health. For many years prior to working in insurance, I saw children, adolescents, and adults in the clinical setting. My area of focus or specialty for many years was trauma, but I saw a number of different life situations during my years of clinical practice. I've been with the Hartford now going on 13 years, and I'm super excited to be partnering with Meg and Alex tonight to bring you some information that I believe is so important these days and that I wish I had when I was stepping into the workforce many years ago. Alex?
Yeah, thanks, Annabelle. My name is Alex. As Meg said, I am a NAMI NexGen alum, and NAMI NexGen is NAMI's Youth Advisory Board. And I currently sit on the NAMI Stigma-Free Youth the Advisory Board, the Advisory Council. So I'm excited to kick off things with a little story of my own. I am a mental health advocate as well as, doing something full time. And I'm super passionate about workplace mental health, especially for young people in the workplace, because I have had my own experience contending with my mental health at work. So since graduating college in 2022, I've actually had 3 different jobs. And, for a while I was ashamed to say that, but I think for now it kind of displays how, I'm looking for something very specific, and especially when it comes to my mental health. So when I first graduated college, I was offered an opportunity at a prestigious institution that I thought, there's no way I would ever give up. For that opportunity, I was flown across the country, and I was excited to see the West Coast for the first time. And for that certain point, things couldn't have looked better for me. And so going further in, it was about 3 weeks when I realized that my mental health was suffering. And for a number of reasons, I think also just graduating college and going straight into, working and doing something really rigorous was probably not the best decision personally. And also I was flown to Oregon, and we were in the Oregon coast, and they were doing trainings and everything for earthquakes and tsunamis. And it's a personal thing, but I'm very anxious about that since I experienced something when I was very young, when I was abroad. And so through experiencing this and a lot of anxiety, and I realized that I wasn't able to do my work. It was affecting my work. I would cry every night when I got back from my work. And it got to the point where I wasn't, sort of sleeping and eating and doing all the things I should be doing because of the anxiety that I was feeling. So I knew I had to talk to someone about it, but I sincerely weighed whether or not it was worth it, since I didn't want it to potentially affect my standing, especially as a recent grad. Like, I had graduated a few weeks before. And also too, at the time, my roommates were working at the same place and they seemed just fine. So I assumed that it was just me feeling these things. So instead, I emailed my supervisor and I just told her how I was feeling. I didn't really bring up the word mental health or mental illness, which is something that I have experience with. I sort of just emailed her and told her how hard it was for me to get any work done because I was experiencing a lot of anxiety and feelings around graduating. And what I learned is that we never really know how people feel. And when we open up in this way, it can unlock experiences and feelings for other people. And so when I got her response, it was a total shock to me because she started opening up about her mental health as well and how she wanted me to be candid about my feelings. And that completely shocked me because this was my first experience out of college, and, something that I approach with a lot of fear ended up being sort of in my favor. So, everything quickly moved after that. In just 2 weeks after I sent that email, I got proper accommodations, and they were actually able to shift my entire role and project so that I could work remotely. So 2 weeks later, I flew back home to Minnesota and I completed the work at home, which was really great. And so, the moral of the story is that no job is worth your mental health. And these conversations don't always have to start out scary. I think for me, I was really scared to bring up mental health in any way. And so just by emailing and talking about my situation and being like, hey, I can't do my work, the work that you want me to do, really opens up the conversation. So I'm excited for you all to learn more about your benefits so you have the power to advocate for yourself. And just to know that you can advocate for yourself in the workplace is a really big deal. And that experience helped me bring a lot into my next job search. So I am also using a lot of these tools, as well as what we're going to talk about in this presentation, to help me find the job that fits best for me. So, yeah.
Thank you so much for sharing, Alex. It can definitely feel like a really scary conversation to have, and we'll get more into this later on, but knowing your workplace culture is just so important, and knowing who you can talk to, who you can ask questions to, it's really important to help us all maintain our mental health at work. So let's dive into our benefits. It can feel so overwhelming to really dive into all of this. I know when I got my first job out of college, it was just a lot. It was a lot of options. I didn't know what it all meant. Luckily for me, it was actually, my first job was at an employee benefits consulting firm. And so I very quickly learned all the ins and outs of all the benefits, but I realized that is not most people's experience. And so it can be really confusing. There's so many different options that are available. We have mental health care coverage, accommodation, short-term disability, long-term disability, employee assistance programs, peer support, digital apps, community resources. I mean, there's so many different options out there and so many different things that people tell us is available, but we don't know how to access. So we're going to really go through step by step today and figure out what it all means and how to actually access it. Starting first with mental health care coverage. Typically, you'll find that this is couched under your medical health care coverage. And just to start more broadly, in-network means that the service is covered at a higher rate, maybe even at 100%, but there might be a copay, which you would pay, $30, $40 for, but everything else is covered. Versus out of network, this is something that is covered at a lower rate or not covered at all. So in network, higher coverage, out of network, lower coverage. A deductible versus copay, this one gets a little bit tricky for some people. It can be very confusing. A deductible is what you have to pay before your coverage actually starts. So you might have a $1,000 deductible before any non-preventative services are actually covered. Currently, we are in our healthcare coverage, we do get 100% coverage for preventative services, which is fabulous. So this is deductibles are just for non-preventative services. And then again, that copay is what you would pay for a service before insurance kicks in and covers the rest. So for example, at the dentist, you might have a $150 deductible and then a $30 copay after you hit that deductible. So again, a little confusing. Every plan works a little bit differently, but in general, that deductible has to be hit first and then it transitions over to a copay. Looking more specifically at some mental health care coverage terms, if you're looking for an individual, couple, or family therapist, your coverage will likely be found under the term outpatient behavioral health. So when you're looking at your plan documents, you'll want to look for the term outpatient behavioral health. For that therapy copay, there might be a deductible, and it's most likely that in-network is covered at a higher rate than an out-of-network therapist. And again, there's different ways that this can be set up. Some companies do a really great job of trying to have out-of-network be comparable to in-network, especially as we really do have a provider shortage right now. Unfortunately, that's not always the case. So definitely check with your coverage to see what that in-network versus out-of-network coverage looks like. And then also, if you're working with a therapist, ask them. They can help you out with this as well. They can provide what's called a super bill for out-of-network reimbursement if that is available to you. And then if they're in-network, they can help you submit all of your claims and all of that. Some terms that you also might see in your outpatient behavioral health plan documents are intensive outpatient programs. These programs are often structured as 4 times a week for about 2.5 hours every day. They're a little bit more support than your typical individual therapist. So if you're struggling with functionality, if you can't quite do your day-to-day activities, your provider, whether that's a doctor or a therapist, might recommend that you go to an intensive outpatient program to get that extra level of support and care to help you kind of get back on your feet. The level above the intensive outpatient program would be a partial hospitalization program. And this program would actually replace your day-to-day work schedule. So typically it's a 9 to 5, Monday through Friday, where you are going for group therapy, individual therapy, maybe some coaching. Sometimes they do art therapy, but it's a much more intensive program for those times when you're really struggling. Your functionality is really not there. You're struggling to just get through the day. That is when a partial hospitalization program might be recommended. And finally, the highest level of care is called inpatient behavioral health. And this covers things like residential programs. It's where you're actually living at the mental health program, getting the highest level of care to make sure that you are staying as safe as possible and that there's people there to help you with any kind of support you need, helping with medication, whatever it is that you need. The residential program would be that option for that highest level of care. Just some notes on seeking a therapist. I know, like I mentioned, we're in a provider shortage right now. First, look for those in-network therapists. Some good websites for that: psychologytoday.com, therapyden.com. You can also go through your insurance network. Oftentimes you'll find a good list of covered providers. Sometimes it might be a little out of date, but those 2 websites and then also your insurance coverage or your insurance provider would have a list of covered individuals. If you're not finding someone who fits what you're looking for, whether it's a certain spoken language that you're looking for, a certain cultural background, a certain specialty, that is when you might need to look at out-of-network options, which again might not be covered as high, but it might be what you need. And we're going to talk a little bit later about some other more community-based options if you do need that help financially as well. So enough about mental health care coverage, passing it over to Anabel.
Thanks, Meg. So I'm going to talk about another benefit that is usually part of your benefits package, which is short-term and long-term disability. Most people know that when you work for a company, you work for an employer, one of the benefits that you'll have is that disability insurance. And policies, they vary, but generally speaking, short-term disability, as the name implies, is for a shorter duration, right? Which is usually up to about 6 months. And during that time period, the person would likely not be able to work for a physical condition. It could be for a mental health condition, which I'm going to get into in a minute. But if for whatever reason you exhaust those 6 months and you're still unable to work because of your, physical impairment or mental health impairment, then you will go into that long-term disability piece, right? Which essentially just means that it's a longer time period, right? People can be on long-term disability for a number of years, depending on what their impairments are. Now, like I said, most people are familiar with disability because they've understood or heard about the physical piece of it, right? Like you may have heard about somebody that is on maternity leave, for example, and they're utilizing their short-term disability benefit, or maybe they've had to be off of work for a surgery and the recovery that comes afterwards. So again, they would use their disability benefit. People are less familiar with disability benefits related to mental health or a behavioral health event. At the Hartford, in my particular department, that is all that we do. We look at claims, we review claims for behavioral health condition. And so I'll provide an example to make it a little bit easier. And this is an example that we actually saw quite a bit during the pandemic. And it's the scenario where someone may have, for example, a loss event, right? So maybe they have lost somebody that is close to them. And so they're experiencing that grief and loss. That grief and loss, especially if it goes untreated, can turn into depressive symptoms. It could turn into anxiety symptoms, right? And so as that anxiety, as that depression begins to intensify, it can certainly impact your ability to work, right? Your ability to focus at work. So that person may start to have, focus and concentration issues at work, or they may start to feel anxiety in the morning as they're getting ready to go to work, or as they're getting into their car, facing the commute ahead. So at that point in time, they may feel the need to see a doctor. And they may go to see a primary care doctor, they may go to see a therapist, right? It all depends on if they've established themselves with a therapist, or, if this is the first time that they experience something like that. And so whatever provider they're seeing, they may then share what's going on from a symptoms perspective. And that provider may then recommend for that person to be off of work temporarily so that they can, attend therapy sessions, so that they can perhaps start a medication regime to get those symptoms under control. And so that is typically how a claim for mental health is started, right? Where you've seen a provider, the provider agrees or determines that, you would benefit from some time away from work so that you can heal. And so the claim gets submitted. Now, during that process of a claim, right? Typically, and every insurance company is different, every plan is different, but typically the insurance company is going to need clinical information from your provider. The provider that is treating you can then provide the reasons why you need that time away. They can provide the duration of time that you will need away from work. And so, you know, you can obviously take the time to heal, to get the treatment that you need, and to stabilize those symptoms. Now, I think that when you are starting off at a company or an employer, this is one of the benefits that you want to become familiar with, because like I said, it can vary, right, from employer to employer, depending on the insurance carrier. And when, you know, with mental health, with mental illness or behavioral health event, it can come on suddenly at times, right? And you can be doing good until you're not. And when you're in the thick of it, that's not when you want to be figuring out what your benefits are. And so, you know, I think it's a good idea when you're starting off with an employer, or, you know, even if you've been with your company or your employer for a while, but you've never looked into what your benefits are, specifically your disability benefits, taking a look at what that is and what your options are. I think that gives people peace of mind, knowing that, you know, should something come up unexpectedly, that you would know what numbers to contact or what steps to take. Next slide. So some of the other benefits that are part of a benefits package and so important when you think about mental health at work. EAP is one of them, the Employee Assistance Program. So this is yet another employee benefit. It's separate from your health insurance. It's paid usually by your employer, so it's free of charge to you as an employee. And there's a lot of services that you can get from your EAP. People typically know EAP to be counseling that you get at work, right? So by design, the Employee Benefits or Employee Assistance Program is there to help you, provide you with resources when you do have life events that are impacting your work. And yes, you know, part of that is offering you confidential counseling sessions, typically short-term counseling sessions. It can range anywhere from, you know, some EAPs will offer you 5 sessions, other may offer you 10 sessions. Some offer you a number of sessions per behavioral health event. They can also offer counseling sessions to your immediate family members or people in your household. So it's definitely can provide you mental health type of programs. But what people don't realize is that it can also help you locate things like elder care or daycare services, or if you're in need of, you know, a specialty provider. For example, say you need a psychiatrist, your EAP can help you find psychiatrists. Meg talked about in network and out of network. They can help you find psychiatrists that are in network, right? They can help you find providers that offer a sliding fee scale if you have to pay for that service out of pocket. They can help you with family planning. They can help you with legal services or mediation. They can help you with substance abuse assistance, financial services. They can help you with budgeting, loan consolidation. They can help you set up emergency funds. There's so many resources that they can offer. And again, it's, you know, if you're working for a company and you know that you have your EAP, you know that resource is there, is spending a few minutes looking to see, you know, which company it is first and foremost, but what offerings do they have for you as an employee? Because again, once you're informed, you know what your options are. It's so much easier once life happens. Peer support or employee resource groups are another, I think, wonderful resource. Number one, to look for if you're looking for employment, right? And you're looking at different companies. I think this really speaks to the culture of a company if the company offers employee resource groups for their employees. And these are usually, they're voluntary groups. They're led by employees, and they aim to foster a culture of diversity and inclusivity. They give you a sense of belonging and psychological safety. And, they usually, and I'll give you an example, over at the Hartford, we have employee resource groups that are Black insurance professional network. We have our Pride ERG for our LGBTQ plus and allies. We have a young professionals employee resource group. We have a mature professionals employee resource groups, right? So it's important to find an ERG that you identify with, that resonates with you, be it your sexual identity, your age, your ethnic background. And it really allows you the ability to be with like-minded people and find, like I said, that psychological safety. Usually the employee resource groups will have activities like courageous conversations, for example, right? Where you can perhaps speak about things that are going on in our world and find a space of trust and authenticity where you can be yourself and talk about these difficult topics, but also have a sense of wellness and, just balance at work, right? Because these things that are happening in our world that happen to you on a personal level, they impact us at work. And so having the ability to have that outlet and that community is really, really helpful as well.
Thanks so much, Anabel. Yeah, those peer support employee assistance programs, they're both such unique offerings that not all employers have, but they're both really valuable because one is that more like professional service, the other one is coworkers coming together and really supporting one another, and both are just hugely valuable. So we're also going to talk about digital apps. This is an offering that not all employers have, but some do, and so we wanted to make sure that we covered it so that you know to ask for this, to see if your HR has any information on them. If you have any awesome mental health apps that you love and recommend, definitely drop those in the chat. Always happy to have new resources to share. But some apps that might be available are some meditation and mindfulness apps. There are also apps that actually help you work through some therapy things like cognitive behavioral therapy. There's journaling and mood apps. There's so many different kinds of digital app solutions that many employers are bringing onto their benefits packages. And they really do cover a wide variety of topics. There's even some that help us with sleep. There's peer support and community apps even. I mean, there's just so many apps out there these days, and it can be a little overwhelming to know what is the best app. So start first with what your employer might offer, because that's where you get those apps for free, or at least at a discounted rate. So definitely check out your benefits, see if there are any apps included even in your healthcare coverage. Some digital mental health apps are partnering with health insurance and kind of working hand in hand with each other. So that is also a way that you can get access to some of these apps. But yeah, digital apps are, they are here. They're making a name for themselves and they're not going anywhere. So share the ones that you like in the chat if there are any that really have worked for you. Let's talk about accommodations. So like Alex mentioned at the beginning of our talk, accommodations are a really powerful tool to work with your company to be able to work as well as you can with whatever it is you have going on for you, right? It's the official description for this. It is adjustments to a work setting that make it possible for employees with disabilities to perform the essential functions of their jobs. And we know we have the right to reasonable accommodations. We all sign that paperwork. Every new job we get, there is that paperwork in there that really protects our rights. There is a lot of kind of different ways to look at this, though. I mean, different workplaces are not always able to accommodate equally depending on what those jobs are, depending on the workplace setting. Sometimes certain accommodations are not possible in certain workplaces as they are in others. So that is really something to work with your provider on and understand what kinds of workplaces are a good fit for you and where are you going to be able to thrive, really working with your provider, whether that's a therapist or a doctor, to really understand, you know, what is like the bare minimum that I'm going to need to be able to perform my job well and really feel like I am able to engage in a healthy way. A great resource to check out is askjan.org. This is our United States government website, all about accommodations, what we are able to ask for, what employers must offer. It helps you figure out what accommodations even are that you can access. And they even have people who will chat with you and work through it with you. So they offer a service where you can actually call in and chat with them, and they will help you figure out what exactly it is you need. So some common uses, we see increased flexibility. So maybe being able to work in the morning, taking a longer break in the afternoon, and then working again in the evening, or even, you know, finding ways to have more frequent breaks than that. So for example, maybe a 10 to 15-minute break every 2 hours, so that you can kind of step away, manage anxiety, you know, take a break to really ground yourself, do some mindfulness, or even move a little bit more, whatever really works for you in those breaks to help you feel like you are able to re-engage in work in a way that works. We can also see this show up as decreasing distractions. So I know for myself as a person with ADHD, if there is a distraction, my brain wants to follow it. So I need to be able to close my office door, not hear anyone else, or my brain doesn't want to focus on creating a PowerPoint. It wants to, you know, listen to the conversation or go hang out with people. It wants to follow those distractions. So I know with my ADHD, I need to find a low distraction area to be able to do my work well, to focus in and really make sure I'm able to engage in a way that works for me. So I'm not anxious trying to, you know, manage all these distractions. And I can also actually do the work that I am supposed to be doing. Sometimes an accommodation can also look like software. So that could be software to help you stay organized, or to manage your time. There's software out there for really a ton of different accommodation needs. But again, this is one where the organization might be able to help, they might not, depending on budgetary issues. But it's still an accommodation that exists and is out there. We do want to notice that there is a difference between accommodations and training. So for some mental health concerns, we might need an accommodation. For some, we might actually need training. So things like time management, for some people, it's a skill that they never learned. Maybe they just never learned it from their parents, from school, they never had to. And so that is a learnable skill. For other people, they might really suffer from, it's a term called time blindness. And you see that in ADHD and some other mental health conditions. And it's where time really just doesn't quite make sense in the brain. And so it feels like a half hour might actually be 5 minutes. Or I know for me, if I see my little notification come up on Slack, you have 1 minute until this meeting. If I don't join that meeting in that 1 minute with that notification, my brain is gone. It does not pay attention anymore, and I'm not going to join the meeting on time. So there can be differences between what needs an accommodation versus what needs training. Some other examples of this: learning how to set goals, how to prioritize. That can be a skill that is trainable and learnable. Organization is a skill that is trainable, learnable. And we also know that for some people, it's not a learnable skill. It is something that will always be a challenge. And so there are differing levels of when we want to look for training versus when we need to ask for an accommodation. And again, a provider is a great place to start with that, to really figure out what it is that you need to be able to do your job well and feel like you can engage in a way that really makes sense for you. Let's talk about community resources. Obviously, super passionate about NAMI. NAMI is a great mental health resource. We have a ton of free programming. If you feel like you are still overwhelmed, you're still feeling like, I don't get this, I don't understand this, definitely reach out to NAMI. We have our helpline later on in the slide, but our helpline can be a great resource to really help you get connected with providers, to talk through things that you're going through and figure out next steps. We have a ton of great support groups, peer programs, educational content, all for free on our website. And we also have over 650 local and state groups if you want to get involved locally. Again, we have those peer support groups. They meet locally. So if you're feeling like you want that in-person camaraderie around mental health, you can check out where your local group is at that link below, nami.org/local. It is just a great resource if you're feeling like you really want to dive into your own mental health and get some more education and awareness around it, and also maybe a little bit of support. So, Anabel, do you want to take this one?
Yeah. So how to start the conversation, right? So understanding the culture of your employer. And I think that begins right when you begin job searching, right? When you're looking for potential employers that you may want to go work for. You know, going onto their websites, understanding what programs do they offer their employees from a mental health perspective? Do they offer employee resource groups? Do they offer training to their managers on mental health, right? So there's a lot that you can learn when you go onto a company's website and you dig in to try and understand kind of what their culture is. But also, once you've made the decision to apply with a particular company and you're getting ready to interview with them, they're interviewing you, obviously, and trying to figure out if you're a good fit for their company. But it's a wonderful opportunity to ask some very direct questions and get a better idea for yourself in terms of, you know, does this company have the culture that I'm looking for, where I can have work-life balance, where things like personal time off are respected or even encouraged, right? So asking things like, you know, what is the culture around mental health in the workplace? You know, does the company offer mental health first aid to their leaders, right? And that's going to make it, you know, earlier Megan was talking about, you know, some of the accommodations, asking for breaks or asking for, you know, time away from your desk for an hour to have a therapy session. That becomes so much easier to do when the staff or the leaders are trained in mental health first aid, right? Because you can have open conversations about things like that, and you can request those types of accommodation without feeling intimidated or feeling scared. You know, is open communication encouraged between leaders and employees? I think part of the questions that we all ask are with regards to the PTO policy, right? But again, PTO policy is one thing. Is time off encouraged? What's the culture like around PTO, right? Because being able to take a day off, on a Friday or a Monday just to kind of reset and kind of, go back to things clear-minded is so important for your mental health and for that work-life balance. Do leaders check in regularly with their employees about workload? What type of checks and balances exists to get a pulse of the employees' wellness and how they're feeling with regards to workload? What kind of offerings are available from a wellness perspective, right? And those are things that we've talked about tonight, right? Things like EAP, or are there digital apps, right? Like, what are some of the offerings that are available? And also, one that I think is very important is, how are the employees' opinions or concerns shared with leadership? Is there some kind of, survey system in place to obtain employee feedback, right? All of those things are super important and will give you a good idea of what the culture of that company is like. Checking the company's intranet. So once you've been hired, once you're working for an employer, going on to the intranet can give you a lot of information with regards to your HR resources, your mental health benefits, leave policy, wellness programs. You can also go ahead and find out about, the EAP services and what offerings are available for you, for your family. But a great resource too, if you're having trouble finding any of those benefits, is your human resources, business partner or representatives. They're always available and willing to have a conversation with you or provide you some of those details that are again, so important for you to be informed and to feel like you know what your options are should something come up.
Absolutely. Yes. Yeah. And it can be really confusing knowing what your benefits are. And so sometimes you need to figure out who to speak to first. So we broke that down a little bit here for you. If you are questioning what your healthcare looks like, what short-term disability, long-term disability, or if you have access to an employee assistance program and what that looks like, that would be a great time to reach out to HR and just ask, in general, what offerings are there? Can you help me understand my benefits? You don't have to go in and immediately tell them why you're asking. You don't need to share that information unless you really want to, or you feel it's necessary to understand which benefit is right for you. But again, you can always ask your HR what you have access to without ever explaining why. If that is information you want to keep private, that is 100% okay. If you're thinking about accommodations, that is a great one to take to your provider first to start that conversation around what is available to me, what might these look like, how to understand your rights. Again, I put in that website twice because I think it's a great website. AskJan.org is also a great place to start if you're thinking about accommodations. And then for peer support or an ERG at work, you can talk to your HR department about that if you feel comfortable asking your manager if this is an option, or even a coworker. And if you want to get those started, start asking around, see if your coworkers are interested, see if your manager might support this. If an ERG doesn't already exist or peer support doesn't already exist, these are things that you can build. And if many employees want to, it's much more likely to start and have that support in order to get started. So yeah, ERGs are a great resource, peer support. And if they're not already available, there are lots of resources out there these days about how to get those started. So definitely feel free to ask me or do some research and get that started at your workplace if it doesn't already exist.
And lastly, like Annabelle said, with the job search, it's really important to, ask these questions. And something that helped me when I was job searching, and it helped me because I was scared to approach this question, is, how like when you're in a job interview and they always ask you if you have any questions in the end, right? I didn't really know what that meant until, going on this mental health journey. But, these companies, they want you to ask questions. In fact, it's like kind of not a good thing to not have any questions at the end of an interview. So use this as your opportunity to ask these questions. And some of them that we have here are like, what are the mental health benefits offered at the company? What is the culture? Ask about leadership, because most likely you'll be in the room with leadership. Ask them about how their experience at the company. And also ones that I like that are more culture related and not necessarily about mental health care is asking them, like, what systems are in place to encourage good work-life balance? Or how often do you work beyond your dedicated hours? How do you ensure that your employees' physical and mental well-being are being prioritized is also a good one, in tackling, mental health care. And you can definitely tell when you're asking these questions, initially right away based on their responses, but also too, I was in a job interview where they didn't really have an answer and they said, we'll have to get back to you on that one. So for me, I took that as sort of like a red flag. Maybe this isn't the company for me. So.
Yeah, really going in with those questions, knowing what you want to see in your workplace and kind of thinking beforehand, like, how do I want to work at work? Let me make sure that they're already doing this, that these supports are already in place so that this workplace really fits for me. Yeah, it's so important. Thank you for going through those, Alex.
And I just wanted to quickly mention, as someone who just recently has been conducting a number of interviews, whenever a candidate that we're interviewing asks these questions, I'm always so impressed, and it makes me feel like they're truly invested, right? Like they're looking for more than a job, they're looking for a home that will be their workplace, right? Like a place that they can truly be in for the long haul, because they're asking questions about the culture, and they're interested in understanding how they're going to fit into that culture. So don't be afraid to ask those questions. I think, Alex, what you said is such a good point, right? Like if the company or the people that are interviewing you don't have an answer, that's pretty telling, and can give you an opportunity to realize if that's the right fit for you or not.
100%. Yeah, thank you so much for giving us the interviewer perspective, Annabelle.
Yeah.
It's helpful to know on the other side, people really do want to hear these questions too.
Definitely.
To know that their potential employee cares about this stuff. So thank you so much for that.
Of course.
All right, so that is it for our slides and our new information. We are going to open it up to questions in just a moment. I did want to say we have a new workplace poll that we're very excited about. We included questions about coverage and how important it is to a workplace culture. So definitely check it out. It is nami.org/2024 workplace. It is really some interesting numbers that really support having this access to mental health care coverage, how important it is to creating a positive workplace culture. So check it out, share it with your employer if you need to really support getting that access, but some really interesting numbers to share. So definitely check that out. And now let's open it up to some questions.
It's question time. Thank you all so much. We have some great questions. Like I had mentioned in the chat, we have only 11 minutes remaining. So I wanted to mention that while we will do our best to get to all of the questions, if we can't cover them all, I believe some of our presenters offered to share a contact so that you can reach out and ask that question. With that, the very first question we received is pertaining to mental health care coverage. Can physicians and medical students also get these benefits? If so, would that impact their career?
So it depends on who you work for that these benefits are provided. So if you're working as an independent contractor, this would need to be something that you sign up for on your own. So for example, when I was in private practice, I had to sign up for my own short-term disability coverage, my own long-term disability coverage, and mental health care coverage. But if you work for an employer who offers benefits, these are things that you most likely do have access to. In terms of, accessing these benefits and if it might impact your career, that is absolutely something that many, many people worry about, no matter what profession they're in. And it is important to know your company, first of all, but also to know, these things should be confidential. So when you're reaching out to HR, that should stay with HR. When you're reaching out to a provider who reaches out to HR, again, it should remain confidential. And so it shouldn't impact your career, right? When you're going for services, we do have what is called HIPAA, and right now the acronym is escaping me. But with HIPAA, our medical information, including our mental health information, is confidential. It remains totally private from our employer. Again, it is something that we want to look at our company culture and really say, does my company culture support me actually taking time off? Do they support me reaching out for help? Do they support me needing extra accommodations? Not every employer is going to be super open to that. Others are. So it is a mix of yes and no. Annabelle, any extra thoughts on that?
No, I think you covered it, Meg. I think the other thing too to keep in mind, I think you said it beautifully when you said, know who your employer is, right? Know kind of what the parameters are, but also remember from the confidentiality standpoint and HIPAA that there are release forms, right, that you would need to sign if information that is confidential is to be released to another party, right? So always, read those forms and make sure that you understand what you're signing so that what confidential information may be privy to somebody else.
Great, thank you. So the next question we have is, their understanding is one needs a diagnosis for insurance and for disability. If clients aren't given a diagnosis due to an unknown illness, or maybe they're in the process of being diagnosed, but it's severely impairing their daily functioning, can the insurance long-term disability work?
Yeah, so many times when people are experiencing a behavioral health event for the first time, they may not have a diagnosis right away, right? They'll go see their doctor and their doctor is going to assess the symptoms, right? So they may have a group of diagnoses, a group of symptoms rather, right? So they might be depressed and they might be tearful and have difficulty composing themselves, or, their mood is unstable, but there's not a diagnosis yet. In fact, it oftentimes will take a few visits to get to a diagnosis, right? So from an insurance perspective, we're looking for that clinical information that the provider is seeing in their session, right? So what are those symptoms? What are the impairments, if you will, right? So there's different realms of functioning, right? You've got your emotional functioning, you've got your cognitive functioning, you've got your behavioral functioning. And so if any of those things are impaired, there's symptoms that fall under those areas. And if the provider can share what those impairments are, then that's how, a disability can potentially get started. And the diagnosis will usually come down the line, certainly. Sometimes somebody can start off with a diagnosis of depression, and in a few months, it turns out that they're really bipolar, right? Because again, you start to see some of those symptoms as you get to know somebody, and providers are getting to know their patients over time as well. Meg, I don't know if you want to add anything to that.
Oh, no, I think you covered it beautifully. You're our benefits expert.
Perfect. Thank you all. So the next question is going to be, for those who do not have employer insurance, can you discuss briefly Medicare versus Medicaid benefits? I'm sorry, and this question was asked during the short-term and long-term disability slide. I hope that's helpful.
Got it.
Yeah, I don't know, Meg, if you have some information on Medicaid and Medicare. My information on both of those is quite limited, but I can share what I know.
My info is quite limited as well. It is quite a specialty coverage. And so, yeah, that, Anabel, I'd love to hear what you do know.
So, when you think about Medicaid and Medicare, Medicaid is typically for people of a certain income, right? Like it's more income based, whereas Medicare coverage tends to be more for people that are disabled or have reached a certain retirement age, right? So I think probably the best advice that I can give is to go on those websites, both for Medicaid and Medicare, and you could probably have a breakdown of the coverages for both of those, specifically as it relates to not just the health insurance piece, but any of the disability benefits too. I'm sorry, I don't have more information on that.
No problem. Thank you so much for trying to cover what you could of that. So the next question is, what is the difference between inpatient care and outpatient therapy?
So inpatient care is when you're actually at a residential facility and you are staying there. So you are staying inpatient at a facility for a week, a month, 3 months, but it is very intensive care where it is around the clock care for your mental health. It could be a residential treatment facility for substance use, something like that. And then for outpatient behavioral therapy, that is where the biggest difference is you go home at the end of the day, your functionality isn't quite as depleted. You're able to engage in day-to-day activities. But outpatient does cover individual therapy. Again, those intensive outpatient where you're getting a higher level of care and then a higher level of care, partial hospitalization programs, those all fall under outpatient behavioral health because you go home after the treatment during the day. Inpatient is where you are staying at the facility for the duration of the treatment.
Thank you, Meg. And I just wanted to mention we are going to squeeze in one more quick question. I know that we're coming to time. If we are not getting to your question, please make sure to send them to the email that was just dropped in the chat. I've seen all the questions and I know how important they are. We want to make sure that we get you your answers. So the last question is really around, have any of you ever seen a workplace help cover therapists that do not take insurance, especially like in a rural area where there's not many to choose from? Do you ever see anything like that?
For sure. So there's a few different options. I believe Anabel mentioned earlier, but there are some practices that do what is called a sliding scale. So they will look at your income, and then based on your income and maybe a few other determining factors, depending on the practice, they will slide their scale down to a pre-assigned number to make sure it's equitable. But for example, my internship, when I was a pre-licensed therapist, we use sliding scale. And so depending on the person's income, based on how many dependents they had living at the house, no matter what age, so how many people were in the house, they were given a certain fee per session that if they could afford it, great. If not, we tried to work with them anyway. And we, you know, maybe we could do every other, maybe we could ask another community organization if they wanted to provide more funding for a certain person, or they asked their church if they felt comfortable, you know, asking for some help funding their therapy. You know, there's different ways that communities can get involved, but there are sliding scale options for many practices. There are also community health organizations that often work for low cost or low fee therapy.
Yeah.
And then, Alex?
Sorry, can I also want to add too and get in there that especially for culturally competent therapy, I think too, if you are like LGBTQI plus, like there are therapy funds that exist. That's how I funded my therapy for almost 16 months from a therapy fund, entirely covered with a culturally competent therapist. So yeah, definitely look for therapy funds, like search it based on like, you know, an identity that you share, because those definitely exist.
Awesome. Thank you so much for sharing that, Alex. That's amazing.
Yes, thank you to all of you. We are over time. I feel like we might have to start doing 2-hour webinars, though I'm not sure how long folks would be able to hang until 10 o'clock on the East Coast time. But thank you again to Alex, Meg, and Anabel. For those who are still with us, please remember we will be sending an email out shortly after the webinar, probably tomorrow. You will get the slides, the recording, as well as a survey. So please fill out that survey for us and share any feedback you have. And there will be a third webinar in the series. So keep an eye out on our social pages, LinkedIn, and any emails that you're receiving from NAMI. And we hope you have a wonderful evening.
Thanks, everyone. Have
Thank
a great
you.
evening.
Good night.